Today, I would like to shed light on two important symptoms of Parkinson's disease that many times we do not take into account, that are very important, that are apathy and cognitive impairment. Beginning with apathy, it is important to consider that apathy is a lack of motivation, a lack of initiative, that the patient lacks interest in daily activities, and it implies a social withdrawal and diminished quality of life, affecting not only the patient but also the caregivers. The neurobiological basis of apathy are not entirely well understood, but dopaminergic alterations are important, and also other neurotransmitters that condition dysfunctioning of the basal ganglia function, where motivation is mainly affected. It implies alterations not only in initiative or in motor initiative, but also in emotional aspects, in aspects of cognition, and important also to say that apathy is not depression. It is different, and we can evaluate it with specific scales. Besides dopamine, other neurotransmitters also plays a role in producing apathy. Perhaps serotonin and also acetylcholine are important in apathy development. Optimization of dopaminergic therapy may improve some patients, but it is mandatory to say that apathy perhaps is the most deserved symptom of Parkinson's disease, in the sense that we have no specific treatments to offer to the patients. There are very few done randomized controlled trials, and the few that we have are not convincing in that sense. Important to say also that social stimuli and participating in activities and stimulation of the patient is important to improve and can improve many patients. But we are in an urgent need of having specific treatments for apathy in Parkinson's disease. Regarding cognition, cognitive impairment is important in Parkinson's from the very beginning of the disease. In patients still not having motor symptoms of the disease, you can see that they have either a subjective cognitive decline or even mild cognitive impairment. And in de novo patients, it is very frequent. And in non-demented patients, 25 to 40% of patients may have mild cognitive impairment. It is evident and more relevant in the executive domains, in the sense that patients lose their ability to make plans, to planificate activities, things such as working memory is affected. And it is also important to acknowledge that memory is also affected in many patients, not memory as it occurs in Parkinson's, in Alzheimer's disease, but the access to the store of memory. Dopaminergic deficits are important for these executive deficits, but with the progression of the disease, other neurotransmitters are affected, and also the progression of pathology conditionates the appearance of more posterior cortical deficits, in the sense that recall memory is also affected. Visuospatial abilities are also affected, and language can also be affected in a way similar to Alzheimer's disease. We have some options of treatment for cognitive impairment, but mainly in patients accomplishing criteria for dementia. But when we have dementia, social activities, functioning of the patient is severely compromised, and we need some options for the stages before dementia, that is for mild cognitive impairment, that is a condition that poses the patient at risk to become demented. Cholinesterase inhibitors can be effective in patients with dementia, but have not been proven to be effective in patients with mild cognitive impairment. And then we are also in urgent need to have drugs or procedures that can improve patients in the stage of mild cognitive impairment or even before. Of course, cognitive stimulation and an active way of life and exercise can improve and maintain cognition in many patients, but we need urgently treatments for mild cognitive impairment. And then both apathy and cognitive impairment are important elements that limit the quality of life of patients and their caregivers and have to be attended with special interest by doctors just to identify that this is a problem and to find a solution or at least an intervention to treat these important symptoms. And this is my message. Just let's fight together to improve recognition of apathy and cognitive impairment and to find new ways of treatment that can improve the quality of life of patients and caregivers. Thank you.